12 Weird Signs of Liver Damage. Did you know that liver damage significantly increases your risk of developing liver cancer? In this video, we'll be going over 12 signs you may have liver damage, which can lead to cancer. Number 1. Spider angiomas. Spider angiomas are small, red blood vessels that appear just under the skin and resemble the shape of a spider or sunburst. They are common in individuals with liver damage, particularly those with cirrhosis. These dilated blood vessels are usually harmless, but can be a sign of hormonal imbalances caused by liver dysfunction. Your liver plays a role in metabolizing hormones, and when it's damaged, this function can be impaired. In particular, elevated estrogen levels due to poor liver function can lead to the formation of spider angiomas. While they are typically not painful or dangerous, if you notice an increased number of spider angiomas on your skin, especially on your face, chest, or hands, it's important to consult a healthcare provider. These can be a sign of an underlying liver condition that may require treatment. Number 2. Hepatic encephalopathy. Hepatic encephalopathy is a severe condition that arises when your liver can no longer filter toxins, like ammonia, from your blood. These toxins accumulate in the brain, causing cognitive changes such as confusion, memory problems, difficulty concentrating, and altered behavior. Early symptoms can include forgetfulness and mental fog, while more advanced cases may lead to severe disorientation, personality changes, or even coma. Hepatic encephalopathy is a life-threatening complication of advanced liver disease and requires immediate medical attention. If you or a loved one experience sudden changes in mental function, particularly if accompanied by other liver-related symptoms, seek emergency medical care right away. Number 3. Jaundice. Jaundice is perhaps the most well-known symptom of liver disease. It occurs when your liver is no longer able to process bilirubin, a yellowish substance produced when red blood cells break down. Normally, your liver excretes bilirubin in bile, but when it's not functioning properly, bilirubin builds up in your bloodstream and gets deposited in the skin and the whites of the eyes, causing a yellowish tint. The condition can start subtly in the eyes before spreading to the skin. Jaundice is often accompanied by other symptoms, such as dark urine and pale or clay-colored stools, both of which occur due to the liver's inability to properly excrete bile. If you notice yellowing in your skin or eyes, it's essential to consult a healthcare provider promptly. Jaundice can be a sign of several liver conditions, including hepatitis, cirrhosis, or liver cancer, and early intervention can prevent further damage and complications. Number 4. Easy bruising or bleeding. When your liver is damaged, it may not produce enough clotting factors, proteins that help stop bleeding. As a result, individuals with liver disease often bruise easily, even from minor bumps, and may experience prolonged bleeding from small cuts. Your skin may develop bruises that seem unusually large or that appear without any obvious injury. Additionally, bleeding gums, frequent nosebleeds, or excessive bleeding from cuts are common in individuals with liver dysfunction. If you notice an increase in bruising or bleeding, particularly in combination with other signs of liver disease, it's important to seek medical attention. Early diagnosis and treatment can prevent complications such as internal bleeding, which can be life-threatening if left untreated. Number 5. Nausea and vomiting. Nausea and vomiting are common symptoms of many health conditions, but when they occur in the context of liver damage, they may signal a more serious problem. As your liver becomes less able to process toxins and waste products, these substances can accumulate in your bloodstream and cause nausea. Additionally, when your liver is not producing enough bile, digestion becomes impaired, leading to stomach discomfort, bloating, and nausea. The nausea can be accompanied by vomiting, particularly after eating, and may worsen over time. If you experience persistent nausea and vomiting, especially if they are associated with other liver symptoms like jaundice or fatigue, it's important to consult a doctor to evaluate your liver function. Timely treatment can help prevent further deterioration and improve quality of life. Number 6. Unexplained weight loss. While many people associate weight loss with diet changes or increased physical activity, unexplained weight loss can sometimes point to more serious health conditions, including liver disease. Your liver plays a significant role in metabolism, particularly in the processing of fats and glucose. When liver function becomes impaired, the body's ability to break down and store nutrients is diminished, which can result in unintended weight loss. In advanced liver conditions, such as cirrhosis, your body may begin to break down muscle tissue for energy, leading to a gradual decrease in weight. Additionally, malnutrition can set in as the liver struggles to absorb fat-soluble vitamins and nutrients, contributing to weight loss. If you notice an unexplained drop in weight, especially if you have not made any lifestyle changes, it's important to have your liver function checked. Left untreated, liver damage can progress and result in more severe health complications. Number 7. Chronic fatigue. Fatigue is a symptom that most people experience at some point, often due to stress, poor sleep, or overwork. However, when fatigue persists despite proper rest, it can indicate more serious underlying health issues. One such issue is liver damage. Your liver plays a crucial role in metabolizing nutrients and generating energy. When it's not functioning well, this process becomes less efficient, leaving you feeling constantly drained. As your liver becomes more impaired, it's also less able to remove toxins from your blood, which can contribute to a buildup of waste products that make you feel sluggish and fatigued. If you're experiencing fatigue that doesn't seem to go away with sleep or rest, especially if it's combined with other liver-related symptoms, it's important to consult a healthcare professional. Chronic fatigue is often one of the first signs that liver function is compromised, and early intervention can prevent further damage. Number 8. Itchy skin. Itching is another uncomfortable symptom associated with liver dysfunction. When your liver is unable to properly filter toxins from your blood or process bile, bile acids can accumulate in the bloodstream and deposit in your skin, causing an intense itching sensation. This itching is often worse at night and can be widespread across your body, though it is most commonly felt on the palms of the hands, soles of the feet, or other parts of your body. The itching can become so severe that it disrupts sleep and daily activities. If you're experiencing chronic, unexplained itching, especially when combined with other signs of liver dysfunction, such as jaundice, dark urine, or abdominal swelling, it's important to seek medical advice. Managing the underlying liver condition can help alleviate the discomfort caused by the itching. Number 9. Dark urine. Dark urine can be another sign that your liver is not functioning properly. When your liver is unable to filter bilirubin effectively, it can accumulate in the blood and be excreted by your kidneys. This leads to urine that is darker than usual, resembling the color of tea or cola. While dark urine can also be a result of dehydration, if it occurs alongside other symptoms like jaundice, fatigue, or abdominal swelling, it could indicate liver damage. The presence of dark urine, especially if it persists despite drinking enough fluids, should not be ignored. It's important to speak to a healthcare professional who can conduct tests to determine whether liver dysfunction is contributing to the change in urine color. Number 10. Pale or clay-colored stool. The color of your stool is another important indicator of liver health. When your liver is not producing enough bile, either due to damage or obstruction of the bile ducts, the stool can become pale, light brown, or even clay-colored. Bile is essential for the digestion and absorption of fats, and when it isn't available in sufficient quantities, the stool lacks its usual brown color. In addition to changes in color, stools may also appear greasy or fatty as your body struggles to break down fats properly. If you notice a persistent change in stool color, particularly in conjunction with other symptoms like jaundice, dark urine, or abdominal swelling, it's crucial to see a doctor. This could be an indication of liver dysfunction or bile duct obstruction that requires medical attention. Number 11. Ascites. Ascites, the abnormal accumulation of fluid in the abdomen, is a common and noticeable sign of liver disease, particularly cirrhosis. When your liver becomes damaged and its function is compromised, it becomes less able to produce proteins like albumin, which help maintain the balance of fluids in the blood vessels. As a result, fluid can leak out of the blood vessels and collect in your abdominal cavity, causing swelling. This swelling is often described as feeling tight or bloated and may be accompanied by discomfort. In some cases, ascites can cause shortness of breath if the accumulated fluid pushes against the diaphragm, limiting lung expansion. A swollen belly can also affect digestion, causing feelings of fullness, indigestion, and nausea. If you notice that your abdomen appears bloated or swollen, especially if it doesn't go away, it's important to seek medical evaluation. Ascites is often an indication of advanced liver disease and requires prompt medical attention to prevent further complications. Number 12. Hemorrhoids. Hemorrhoids are swollen veins in the lower rectum and anus, often caused by straining during bowel movements, constipation, or sitting for long periods. However, in the case of liver disease, particularly cirrhosis, hemorrhoids may be linked to increased pressure in the veins that carry blood from the intestines to the heart. When liver function is compromised, blood flow through your liver becomes obstructed, causing blood to back up in the veins. This increased pressure can lead to the development of hemorrhoids, as well as other enlarged veins in your gastrointestinal tract, such as esophageal varices. If you experience persistent hemorrhoids that don't improve with common treatments, or if they are accompanied by other symptoms like abdominal swelling or jaundice, it's essential to consult with a healthcare provider. Hemorrhoids in the context of liver disease can indicate increased pressure in the circulatory system and may require further investigation. Those were the 12 signs of liver damage. Did you know that having liver damage can increase your risk of developing colon cancer? Check out this video to learn about 12 signs you may have colon cancer. Thanks for watching. See you in the next video.